this week's edition of Health Check, where myself and colleague Dr. Nosipo Mhlanga give you your weekly reminder to check in on your health. So join us in conversation on all our social media platforms at Health Check SA, where we engage on health matters. Our skin is the largest organ in our bodies, and we're often reminded to protect it at all costs. But what happens when our bodies react to certain medications or infections and leave us with a potentially life-threatening condition? Well, this week we tackle a disease called Stevens-Johnson syndrome. With approximately 1 to 6 cases recorded per million people globally every year, the rare skin syndrome requires urgent medical care. My colleague, Dr. Nosipo, has taken to the streets to meet with someone with a harrowing journey dealing with Stevens-Johnson syndrome.
Today, we're in Soshanguve in Pretoria at a primary school where Rifule Nkale is a teacher, and she has a moving story to tell about living with Stevens-Johnson syndrome. Let's go check in with her.
I didn't take it serious at the time in Kalukula. You can imagine I was 28 at the time. And then my husband had just paid my lobola. We had bought a house together. I was young, working with the senior educators. At the time I can say, God's favorite. Everything was perfect. There was a picture, my maternity shoot picture. I look beautiful. That's the person I knew. Then I looked in the mirror. The one that I saw was different. Then I told my husband, why did God do this to me? I'm Rifule Nkale. I just turned 30 on the 1st of June. And then I'm working here in Soshanguve Kintani Primary School.
So ngashela ukuthi before uqala ukugula, impilo yakho beyinjani ekhaya and as a teacher?
It's ngiqale ngale yasekhaya, ne? Ekhaya bekumnandi. I just had my twins at the time. I was a registered teacher also, teaching maths in grade 4 and grade 5. And then I was active. I was active in most of the things. I would go to workshop, la bayosifundisa khona izinto zokusikhulisa in our career. I would facilitate workshops in the hall for our colleagues. Like, everything was perfect at the time.
And then kwaba njani ngesikhathi uqala ukugula?
Because my body was in pain most of the time. Mangvuga, in the morning I had headaches, and then my eyes were itchy most of the time. Then my joints, my back was painful. But I did not think it's something that will last long. My mom Aramugai, when she looked at me, I don't know, but it's itchy everywhere. I don't know why. Then my husband gave me a cloth, a wet cloth. I placed it in Lomeni, Ngalala. I didn't take anything because being as routine petro, I slept. Then in the morning, it was worse, even on the lips. The lips were getting bigger, the eyes, everything.
And how long did Lama symptoms last if it was more than that 10 days?
I had just recovered from COVID, and the symptoms were similar to the ones that I had the time being tested for COVID. So I just thought maybe it's COVID, izodlula now, just after 10 days, you'll be fine. I told my husband that I'm not feeling well, and then he just said, no, maybe you should just go and vaccinate. Uzoba right, yabo.
And then bagisa ke esibhedlela.
No, Anyanga Esbelel at the time. My husband, when he came back, we went to my GP because I didn't think it was anything hectic, you know. We went to the GP. And I remember I was standing, like in the consultation room, I was standing up. Is it painful? I was like, yeah, it's painful everywhere. He said, you can't even sit down. I said, you don't know how I'm feeling. Like everything is burning at the time. Then he said, no, it's chicken pox. I was like, chicken pox? But I had chicken pox in 2018. What are you talking about? He said, I think you were not properly treated. I was like, okay. I told my husband that the doctor gave me this and this and that. We went home. And then obviously I took the medication and slept. And on the night, yeah, it was better. I slept better.
And when you woke up in the morning, was it worse or had it gotten better?
The sores, they were no longer there. Ne? But then I was starting to see blisters now. Instead of the blisters getting better, they got worse. Like they were multiplying in seconds. Then my mom started worrying. My mom is a Christian, and she started thinking, ish, black people, that's witchcraft, man. Look at how things are going in your life. And then now you start feeling like this. I'm like, no, get over sharp, don't worry. At the time, I could not open my eyes. I could only see bright colors because they were so thin. Could open them like you. I could only see yellow, white. If it's blue, if it's human, I can hear you, but I can't see you properly. And then I heard him talking on the phone that, ma'am, skin his skin is peeling. So I did not even understand, like, my skin is peeling. What is he talking about? And then my husband asked, what is it? And then the doctor said, it's severe impetigo. She's going to be fine in 2 to 3 days. In my head, 2 to 3 days, I'll be fine. Then my husband drove me straight to the hospital.
Man, what happened?
We waited because my husband, I kept hearing him complaining, telling them that she's in pain. She's in pain. They kept saying, we are waiting for a bed. There's no bed in the ward. We are waiting for a doctor because your doctor didn't even specify who he is referring her to. But my husband kept on persisting that you need to help her. She's in pain. Because at the time, I remember I had a face cloth like this. Because from what they told me, they said something yellow is coming out of your mouth. I could not see.
And I'm sure Menfika Bedlela, you were both expecting, well, maybe not so much you, but he was expecting 2 to 3 days for you to be in hospital. How long did it actually take you to recover?
After the 2 to 3 days, according to me, maybe I'm on day 2. Bana ba tshwere one mabane. But I was like, Bana ba tshwere mabane. One, what are you talking about? Yeah. Then my husband started saying, how bully. And then I just got emotional. I was like, doctor, we said 2 to 3 days. Then I asked my husband, then my husband said the name, Stephen Johnson syndrome. I couldn't even understand what he's talking about. Saying nothing made sense at the time. No one made sense to me at the time. I just wanted to go home, wanted to go to work. I wanted to live my life. But I couldn't. I was stuck in a hospital bed, machines beeping in my ears. Like, everything was just painful.
After the break, we hear from our expert, and Dr. Nosipho continues with our SJS survivor, Refilwe. The data on SJS in South Africa is very scarce, with no countrywide studies performed to investigate epidemiology and the outcome of patients with SJS. Now, Dr. Taryn Jacobs joins me now to help us understand this rare condition from a medical perspective. Now, Dr. Jacobs is a dermatologist with a world of experience in the management of complex skin conditions and is also part-time lecturer and consultant at the University of Pretoria. Dr. Jacobs, welcome to our show.
Thank you for having me.
All right, we're talking about this condition. First of all, let's just define what this Stephen Johnson syndrome is. What, in simple terms, what is it?
So Stevens-Johnson syndrome represents a very severe, rare form of a skin drug reaction. And that means that we nearly always see it with medication. There are some rare cases, some minor presentations where it can be caused by infections like viruses, but in most cases it's due to medications and it can be potentially fatal.
Okay, so essentially it's a skin condition primarily. And how does it manifest? You know, what do people go through?
So before a rash even starts, there's usually a prodromal illness of several days. So that means flu-like symptoms, upper respiratory tract symptoms. So patients can get cough, fever, runny nose, and so on. And then a rash starts to develop. And in dermatology, we call it an exanthem or a mobiliform type of rash. But then after a period of a few hours and sometimes after several days, this starts to evolve and we see a blistering eruption. And these blisters, they merge to form areas of skin detachment. So what you see then is this exposed red oozing dermis. What's very important to mention is that there is mucosal involvement. So the mucosa is lining the eyes and the mouth and the genital urinary tract. And so that means patients' eyes get red and sore, crusted lips, painful mouth ulcers, and then genital involvement and urinary tract involvement, even esophageal involvement as well.
You mentioned that, this develops over a few days. Is that the case with every case, or, can it develop within a matter of minutes?
The difficulty, I think, is at the beginning stage where things can look a bit non-specific and very subtle to people who are not familiar with the diagnosis. And so I think the best thing is at the primary healthcare level to be aware of what medications are high risk and be aware of the timelines that are associated with Stevens-Johnson syndrome. To a dermatologist, usually a dermatologist will be able to pick up some of the subtle clues. And one of the things we can look for is that of skin pain or skin tenderness, because in about 90% of cases you have that. The other thing is often when the rash starts, there's this dusky, dark hue to it. So these are some of the subtle clues that a dermatologist can perhaps advise on diagnosing Stevens-Johnson syndrome early.
All right. Now, we say that, this is a very rare condition. And I'm going to ask you, we obviously don't know the true extent, in South Africa, because I would imagine we don't have published studies. Right. What's your experience? Are you seeing more and more of these conditions, or is it, 1 in a million? Globally,
and so the rate is actually 1 to 5 million cases annually in the population overall. This is something that one would see more in states, but definitely coming from private practice, you have a few cases. Another thing that I've mentioned is that there are some population groups that are at higher risk. And so in South Africa with the HIV epidemic, look, we know that patients with HIV/AIDS have about 1,000 times increased risk of developing Stevens-Johnson syndrome. So we are seeing increased cases in the hospitals because of this.
Why should that be the case then with HIV population, so to say?
Right, so some of the medications that people are on, so antiretrovirals, some of the treatments can cause Stevens-Johnson syndrome, but we're also seeing it in patients not on ARVs. Some of the antibiotics that are used prophylactically to prevent serious, pneumonias and infections can also be the culprit.
So talk about risk factors. Perhaps let's stay there, because I think it's quite an important one to talk about, to say, before we can even talk about prevention, we need to understand what the risk factors are. You mentioned antibiotics. Is this antibiotics prescribed by doctors, or, is it stuff that people can get over the counter from neighbors? Your comment on that?
Absolutely. So the main drugs that we see causing Stevens-Johnson syndrome or relating to it is antibiotics. So usually the sulfonamide groups of antibiotics, also what we call the beta-lactam group of antibiotics. And this is something that obviously needs a prescription in South Africa. We also see it with the anticonvulsants or anti-epileptic medications. And then we see it with a medication called allopurinol, which is used to treat gout. Now, the timeline typically is between 7 to 21 days after starting these new medications. With the anticonvulsants, it can be even up to 2 months.
And okay, so obviously it's 7 days up to 2 months for symptoms to start developing.
Right. For you to now develop the symptoms, absolutely right, yes.
So with that case study in mind, how important is it to get an early diagnosis so that you start management as soon as possible?
Yeah, I think an early diagnosis is really critical so that there is a rapid discontinuation of the drug, because the prognosis is correlated to how quickly the medication is stopped. So it is something that you want to diagnose early.
Right. And in terms of, we talk always about, antimicrobial stewardship and so on, and people actually walk into doctors' rooms demanding to, have scripts of antibiotics. Your comment on that as a risk factor for development of Stevens-Johnson syndrome?
Yeah, I think it underscores the need of when you as a practitioner prescribe something, there has to be an indication where, whether the patient wants it or not, there has to be an indication. I also think it's important to stress that Stevens-Johnson syndrome, we mentioned, is very rare and it's unpredictable. And these medications are used to treat conditions that are life-threatening at times if it's not treated. So these are serious conditions. It doesn't mean that you need to not prescribe these medications or not take the medications that you have been prescribed.
Coming up next, Dr. Nosipho continues with Refilwe, and our expert gives us her final thoughts about this rare disease.
I don't interact a lot. I can't say I am hiding, but I feel like the distance during the 1 year, 8 months of healing, the distance made me stronger, and it made me realize that I am stronger than what I thought I was. So I am relying on myself more than other people. I no longer allow what people say about me affect me.
And what was recovery like at home? Now you're at home, you're trying to get back to yourself. How long was that process for you where you were at home? And how was recovery like at home?
I can say Friday, the Friday that I was discharged. When I got home, I could not see properly. My eyes were still painful and everything was blurry at the time. I remember when my husband opened the door, one twin was at the door rushing, "Papa," and then I was the one who got in first, and then he turned crying. I couldn't wait to get out of bed, move around my house. I went to the mirror first. What I saw in the mirror changed my life. Then I can't say I recovered after that because I got worse. That's when the suicidal thoughts came. That's when I started asking myself, where is God and everything? Because
And on a day-to-day, you had mentioned that you don't spend a lot of time outside. Are there any adjustments you've had to make with your life at home and your life at work? Like if you can't walk outside, what is it that you do that tries to help you to cope at work and at home?
I cannot see properly because the lights, they affect me, and the sun outside. Like if there's lights inside the house, still I can't see properly. And then outside the sun here. And when it's windy, my eyes just start acting up. My eyes, most of the time, they tear up. So I have to always have something in the hand to wipe. But with the kids, I remember before the curtains, I was moving around other classes, and other classes were bright. You find that in 4 rows, I could only look at 2. When I taught, most of the time, I would focus on the 2 rows that I can be able to open my eyes at. And then, with kids, they feel like, okay, and then we had to explain, no, ma'am is going through a medical condition. But now, like most of them, if they see me walking outside alone, ma'am, like they even, for sometimes I tell them, no, today, like it's not sunny, guys. I'm fine. I can see. I'll just hold on to things. Let me hold your hand. Like now, I feel like they have adjusted to the new Memukale, because the old one, the new was, hey, I was running around, but now I am taking it one step at a time.
What is it that you do that tries to help you to cope at work and at home?
At work, when I walk, if my assistant is busy, I always have a liner by my hand. They are the ones guiding me, showing me that mem steps, mem follow. Understand? I move around with them, and then inside the classroom, mostly when I move, I tap on their shoulders to check where I move. I'm getting there. it's not that bad after all. Getting there, I'm left with the scars are still there on my body. The eyes, according to the eye specialist, no one has a date that they'll be fine on this day. No one is sure if they'll ever be perfect. But as long as I can see, the vision that I have now of you, I think it's perfect because I can see you, like I can see everyone. So I'm happy.
Your story is the picture of strength, and your recovery is really inspirational. So thank you for sharing with us.
Thank you.
Talking to Refilwe, it's clear to see how this condition has taken an incredible toll on her mentally and physically and on her family. And with all the challenges that she's gone through with the Stevens-Johnson syndrome, it's a wonder to me how she's still standing.
In severe cases, SJS can cause toxic epidermal necrolysis, or TEN, which can be life-threatening. Those with compromised immune systems, that is, people with HIV and AIDS or those undergoing chemotherapy, are most at risk. In very rare cases, it can be passed down genetically. So we've described this condition, and it's quite an horrific kind of condition for anyone to have. Having described all of these issues that we've spoken about now, does it mean that people should now start getting worried, panicking about having to look out for signs of Stevens-Johnson syndrome? What's your message to the public out there?
I think when it comes to health, there are certain conditions that's really pertinent to discuss. So it's good to bring awareness to this, but it is a rare condition, as we've said, and there's no need to create panic. If you are on a high-risk medication, like the anti-epileptics, or if you've been prescribed certain antibiotics or treatment for gout, then I think you should really be aware of this, and the general public as well. But there really is no need to panic. I just think it's a good platform to share some information on this.
Thank you so much for your insight.
Thank you very much.
Refilwe's journey with this incredibly rare disease has been one of great tragedy, but also of resilience like no other. We hope that Health Check has helped you check in with your health. Should you have interesting thoughts on SJS, please reach out to us on social media and tell us your story. At Health Check SA on all our social media pages. And remember, stay healthy, stay vibrant, and check in on your health.